I wouldn't have much to say. I just wanted to welcome you all for this very, very important occasion. It has been a very challenging time when we started looking at this new registration system, healthcare registration. I do not forget our other colleague regulatory bodies of the department, the Medical Board of Papua New Guinea, the Pharmaceutical Board, who are also going to be part of this system. It took us about 3 years to establish this system with the support of DPET and the department.
Thank you for the invitation. Even if you didn't invite me, I would still come. Because it's such an important program, and to be part of this launching of this new regulatory system, so that the largest workforce in our country, the nursing workforce, our nurses and midwives, this is what we call smart government. Harnessing information technology to manage the systems of government is all about smart government. And I am in full support of any program within the country, and now that I'm Minister for Health and HIV/AIDS, a system that harnesses technology's capability, I believe is the right direction we have to go. And so when I received the invitation, very short notice, I said I'm going to come because it's something that I am also very passionate about, like yourself, Chairman. And we are very, very lucky that with the support of the Australian government and the people of Australia through DFED, we now are proudly going to launch this wonderful, wonderful new system. I remember at times when I was Secretary for Health, for example, the tsunami came, and we wanted to know who are the retired nurses in the country that we could call upon. Where are they? What is their updated training program in terms of their professional development? And there was none. Because all registration is, as you say, is through the age-old paper system, and we know when the manager of the paper is not working well in the office, the files are everywhere. But we got the computer or the laptop or the phone with us today. And so, as you recall, some of you, when I was appointed Minister for Health and I gave my 100-day commitment, e-health was one of those. It's harnessing technology because, for example, in the specialist area, we will not produce all the specialists that we need in the country. But if we can use the telemedicine to have specialists seated in all the provincial hospitals to hook up to the difficult labor that is happening in health centers throughout the country, we can safely deliver the mother and the child. And so this is part of the overall thrust, is a commitment that is very, very important. And so today, our Papua New Guinea Nursing Council, we're very proud to be able to launch this new health practitioners registration system. Particularly workforce information on health is so very critical that we have systems that we can, at the press of a button, bring the information that will help us to properly plan, properly manage, and properly monitor what's going on in our nation. So we're only 42 years old. We got a lot of space, and the Vision 2050, if you look at the 7 pillars, second pillar is human resource development, institutional strengthening, and this is part of that institutional building. And you know, I've always been reminded of these 3 I's that the ADB always talk about, important for developing nations. If we can develop the public infrastructure to cover the entire country, infrastructure, whether it's IT infrastructure or road or water or power or communication, this is big time. Developing nations will move forward in a big way, and that's the first I. Second one is institutional strengthening, building of institutional processes, and this is one of them. It's the for example, the agencies of state. in the three arms of the government, judiciary, parliament, and executive. If we can build strong institutions, no matter whatever the politics is, it's the strength of the institutions that will hold our nations up. It's been proven globally. For example, when the Asian crisis came, nations with strong institutions stood the test. They stood the weather from the crisis. And the third eye is innovativeness. And this is part of it as well. It's trying to think out of the box and bring in the best global practices in the country. And I think this is why in the global discussions on when nations or governments harness technology to manage the systems, we always call it smart government. This is what we as a nation must now move into. It's thinking smart, thinking outside of the box, and taking actions. And so I cannot but admire the work that has been done. It's taken quite a long time, as Chairman has alluded to us. But we are going to be proud owners of this wonderful system. And as Chairman has said, I would want the other health cadres to move into the system, and if we can expand the DFED program to cover the registration of medical practitioners, registration of pharmacists, we will have a whole system. I don't want to see one quota done and DFED leaves us behind. So there will be a formal request that will come if we can extend this wonderful program to cover the entire system. As you know, we have the new health practitioners bill that is coming. Hopefully, myself and Secretary are working very hard to get the State Soul to give us a clearance. And then November sitting, but hopefully in February sitting of Parliament, I should be able to proudly present the bill. And this is the forerunner of our ability to bring a new legislation to govern the registration, the practice of health practitioners throughout the country. And it's so very, very important. I mean, you and I know have had experiences in the country of overseas health workers that are coming who are not well qualified, but we register them, and when there's a problem in the operating theater, then we wake up and say, oh, he should not have been registered. He's not a qualified medical practitioner. But the system failed us, so we bring in all types of systems. So this will be part of a security, yeah? It's a security, part of the security for our nation, because we want properly qualified, domestically and internationally, practitioners that are coming to protect and provide global standard healthcare services in every corner of our country. And this is a trailblazer, and I am very, very proud to be here, and I look forward to pressing whichever button is sitting there. Michelle will tell us what to do, but we look forward to seeing what this package is, so that we can then be able to hook on the other large number of health workers in our country. 3 days ago, one of my friends asked me, how many doctors have you got? How many nurses have you got? How many midwives? I'll give you time after this. I wish I was invited before he asked me, but I said I'm going to launch it, so I should have invited him to come in. But thank you, Chairman. Thank you, DFED. Thank you, Nation Council, for taking this initiative, and we look forward to letting our nation know that we have a upmarket registration program for nurses in the country and roll into their health workers. Thank you very much.
Ladies and gentlemen, you put him on one thing more.
I thank everyone once again for coming, and I think this is part of the overall enhancement plan of our human resources, that we need to put systems in place administratively to address part of it. But we have the human resource policy for the health sector that was developed in 2013. The government approved the human resource enhancement plan, and there are a lot of systems that are required by that plan to be put in place. And one is today that is going to be launched. The Minister, as part of his 100 days commitment for a long-term human resource plan for Papua New Guinea. So we are putting in some framework, a scope of work that need to be put in place so that, you know, a workforce plan for 30 years or 50 years doesn't take 100 days to do. It might take a bit more than that. But some of the first steps are starting to take results. So I'm grateful to the team and the vision of the Nursing Council. I have been commenting in the last few years about some of the governance process that we have in the department. And the pharmacy board, I think one of the babies that our former secretary, now the minister, has put in place the pharmacy board and the law, which is now making our work in pharmacy one of the success work in terms of its regulatory function. And I have been commenting on it. And now lately, in the last 2 or 3 years, I have been commending the Nursing Council with the assistance from Michelle and the team, new council, board and chairman. They have been very effective, and I can see that they are coming in a big way. That every time they see me, something new is happening. And the challenge is now on the other boards, especially the big one like the medical board, the National Health Board, to do likewise, that we need to improve because the expectations out there are now high. It's not just registering the public servant workers. We now need to register private practitioners as well. And some come at very big companies that require actions to be done within days or even hours. This kind of innovation and development taking place in the health department, I'm so happy that it is starting to happen during our time. So with that, I congratulate the Nursing Council and all those people that have contributed to this development. Thank you.
To all the other guests. I'm really happy to be here at this launch of the Health Practitioners Registration System. Australia is committed to long-term partnership with Papua New Guinea. Our commitment in health is strong. It's one of the key priorities in our development partnership with PNG. A key component of this support has been working with PNG to develop its human resources for health to serve the people of PNG. Responding to the World Bank's 2011 publication, Papua New Guinea's Health Workforce Crisis, a Call to Action, and PNG's guiding policy document, the Health Workforce Enhancement Plan, PNG has achieved positive outcomes to enhance the size of its health workforce and improve the skills of its doctors, nurses, midwives and other health professionals. The Nursing Council of PNG plays a critical role in regulating nursing and midwifery professionals across PNG. Australia has worked closely with the Nursing Council of PNG to ensure that the Nursing Council fulfils its legislated role to protect and promote the public interest through the maintenance of nurse standards. In 2011-12, Australia funded capacity diagnostic audits of all nursing schools across PNG to assess where schools could benefit from further training of staff, infrastructure and teaching resources. Since 2013, Australia has provided advisory support to the Nursing Council. This support's been provided by Ms Michelle Rumsley and has sought to assist the Nursing Council to strengthen its governance and health worker registration systems and protocols. Michelle has also worked with the Medical Board. In addition to support provided by Michelle, Australia has funded several staff at the Nursing Council to assist with its administration and with the implementation of the new health practitioner registration system that we're here to launch today. Registration of medical professionals in PNG is critically important to strengthen the health workforce. Not only is registration important to ensure that there is an accurate record of the number and location of health workers, but it is a central starting point to ensure the skills and quality of services provided by those registered practitioners is maintained across their entire working lives. Much work has been carried out by the Nursing Council over the last 5 years to streamline the process for registration. As we recognise today, significant work has also been undertaken to cleanse the data from the previous healthcare practitioner regulation system and implement the new health practitioner registration system. I commend the work of the Nursing Council of PNG in undertaking this lengthy and complex process of reform. Australia remains committed to supporting PNG develop its health workforce. We're building on our support to date of training over 1,500 midwives, nurses, community health workers through Australia Award Pacific Scholarships. We will continue to provide scholarships for midwifery schools and some nursing schools in 2018. I thank you all for your very hard work and look forward to seeing the Nursing Council build on its reform agenda over the coming years. Thank you.
Can you just tell us about the launch, how it went? Personally, I just think that it was great. In fact, it was more than what I actually anticipated. Firstly, with the health minister of Papua New Guinea being present and gave an opening speech that was, truly wonderful. And with his support, we know that in future he's going to further support us in the work that we're doing in the council office and for the profession throughout the country. And Secretary of Health was here too, DFED and all the other dignitaries, our major stakeholders were present, along with hospital staff from Port Moresby General Hospital, the institutions, and
What will an improved registration system mean for the population of Papua New Guinea?
I believe that it is with more nurses being trained and registered, licensed to practice, that will improve health service delivery for the people of Papua New Guinea enormously than what it has been over the past years, yes.